Sometimes when I treat the Epstein-Barr, their chronic fatigue and all of their symptoms are gone. So sometimes it's not just the Lyme that you need to be looking at. You need to be looking at these other co-infections. And other co-infections include Babesia and Bartonella and Ehrlichia, a whole host of other Lyme co-infections, but of course the EBV, the CMV, the herpes, and I find varicella and measles, mumps, and rubella a big issue in these patients. And some of my patients who are older haven't even been vaccinated with these vaccines, but these viruses, like varicella or like mumps or measles, they, in some susceptible individuals, can cause an autoimmune response. And by that I mean elevated antibodies in the blood. And when we treat these antibodies with low-dose immunity, low-dose immunotherapy, which I'm going to be getting to in just a second, we can see these antibody levels come down, but these patients also get better. So that's an important area to look at, is to look at other infections in these patients and not just focus on the Lyme. I do stool testing because a lot of my patients have GI problems. So it's very important to do, the functional medicine tests and find, if they have parasites or yeast. And I find yeast to be, just rampant in these patients. So treating the yeast is very, very important. And some of the ways that I treat the yeast is with antifungal therapy. There are herbs that we utilize. I find that the prescription nystatin, very gentle antifungal, or fluconazole seem to be really effective in helping these patients.